Good afternoon and Happy New Year. Let me begin by offering my profound condolences to the family, friends, and colleagues of Calgary Police Sergeant Andrew Harnett, who was killed last night by a driver fleeing a traffic stop. His death reminds us of the very real risks taken by police officers every day to protect public safety. This was a terrible crime, and I hope that the perpetrator is brought quickly to justice and that he or they face the most severe consequences possible under the law. As you know, the Calgary Police Service has identified apparently 2 suspects. I ask that anybody aware of their whereabouts, please contact the police immediately. Let us all keep Sergeant Harnett's family and his police colleagues in our thoughts and prayers during this tragic time. And the next time you see a police officer, please thank them for their service to all of us. I'd like to address issues that have emerged regarding international travel and then provide an update on Alberta's COVID-19 vaccination program. Albertans have made enormous sacrifices over the past 10 months to protect our healthcare system from COVID-19. Thanks to those efforts, we have succeeded in bending down the curve in recent weeks as the number of active cases has fallen by about 1/3. Of course, we must stay vigilant. From the beginning of the pandemic, Alberta's goal has been to protect lives and livelihoods. Our approach has been to focus on public education, encouraging personal and collective responsibility, and using targeted restrictions as a last and limited resort to control spread and to prevent our hospitals from being overwhelmed. One aspect of that careful and balanced strategy has been our approach to travel. Back in March, when the federal government was refusing to take meaningful border control measures or to suspend travel from COVID hotspots, I called on them publicly and directly to do so. Alberta was the first province to put in place its own system for screening arriving international travelers, both at our airports and at the Coutts Land Port of Entry. As we moved into the summer, Alberta's government began calling actively for measures to allow for safe travel using our expanded testing capacity and other technologies. I called publicly and at several First Ministers meetings for Canada to follow the lead of many other jurisdictions that had adopted safe travel policies, like, for example, requiring international travelers to produce evidence of a negative test. We commend the Government of Canada for finally having announced such an approach, as they did earlier this week, and it will be effective, I understand, on January 7. Alberta was the first and only province to adopt an international travel pilot program to facilitate safe travel with a reduced quarantine requirement for arriving international travelers. The program has been a success with, we think, over 20,000 people participating voluntarily as of today, and a test positivity rate of 1.48% on the first test. This compares to an overall positivity rate in the province of around 7%, and it means that we've been able to focus effectively on isolating those individuals who tested positive to keep others safe. Alberta also worked with WestJet and Air Canada and the state of Hawaii to launch a safe travel program for Canadians traveling to that state last month. They can now obtain a COVID test here at their own expense before flying to that state. And finally, Alberta has been the only province to remove an advisory against non-essential domestic travel from other parts of Canada. We have consistently been against proposed interprovincial travel restrictions, and unlike some other provinces, have continued to allow for the safe operation of important parts of our tourism industry, like hotels and ski hills. And I know that many Albertans have taken advantage of interprovincial travel, for example, likely tens or hundreds of thousands visiting neighboring provinces this past summer. All of this is to say that Alberta has sought to support and facilitate safe travel during the COVID era. We've done so as part of our effort to protect both lives and livelihoods. Completely shutting down travel would result not only in tens of thousands of more job losses, but would likely result in the financial collapse of Canada's airline industry, which is essential an essential part of a modern economy. For Alberta, that is particularly the case for WestJet. If all or almost all travel was to be suspended, I do not believe that WestJet could survive. And the failure of that company would frankly be a catastrophe for Alberta's economy and for our prospects of recovery and economic diversification in the future. These are some of the reasons why we have promoted safe travel. And to be clear, given all of the precautions being taken by airlines and passengers, the risks of transmission while traveling are, quotes, extremely rare, in the words of the head of the Public Health Agency of Canada, Dr. Tracy. Recent studies concluded by Harvard University and the U.S. Department of Defense have both concluded that air travel has, this past year, during COVID, has been a less significant source of viral transmission than regular day-to-day activities like going to a grocery store. In this context of safe travel, between 10 and 20,000 Albertans are moving through our airports every day right now. Hundreds of thousands of Canadians have traveled abroad over the past 10 months, and tens of thousands of Albertans are currently out of the province, many of them on vacation in warmer climates. Tens of thousands more have plans to do the same over the months to come. So let me be clear. There is no public health order or legal barrier barring them from doing so. What we ask of all of those people, in fact, what we require of all of them legally, is that they scrupulously follow all of the travel-related public health orders. That includes not traveling if they have symptoms, 14 days of strict self-isolation upon arrival, unless, of course, they're participating in the pilot program, and, of course, complying with the new federal pre-testing requirement, which comes into effect a week from now. This past Tuesday afternoon, I became aware that Minister of Municipal Affairs Tracy Allard had traveled to the United States before Christmas. I immediately contacted the minister and asked her to return to Alberta, which she did immediately, arriving back yesterday morning. I should be clear that while away, Minister Allard continued to work on her important responsibilities. I was on calls and participated in virtual cabinet committee meetings in recent days in which she was an active participant. I've also become aware that a few MLAs, political staff, and senior government officials have traveled abroad in recent weeks. In doing so, I'm assured that they have complied with all relevant public health orders and legal requirements. Nevertheless, I recognize that those of us in positions of public trust must maintain a higher standard in our personal conduct than is expected of the folks in the general population, in the general community. And here I take responsibility for not having clearly set out or communicated a policy against international travel for senior decision makers in government. I should have done so. To be blunt, I'm not in the habit of tracking or regulating what the people who work for me do on their personal time. I believe that these individuals acted in what they believe to be good faith, have complied with the legal requirements, including the COVID public health orders. But for those of us in leadership, I acknowledge that is not good enough. We should be here at home, plain and simple, if we carry a position of public trust. And that is why I am issuing a clear directive today to cabinet ministers, government MLAs, political staff, and senior executives in the Alberta Public Service not to leave the country for the foreseeable future unless it is absolutely required for government-related business. And I see that as being a very remote possibility. In 10 months, I have not found a requirement to travel abroad for government-related business. I understand that individuals who were abroad have either returned or are in the process of doing so. Again, I take responsibility for not having been absolutely clear about this expectation. And I do not believe that I can sanction people who complied with the law, with the public health orders, and who in fact participated in the kind of safe travel that our government has facilitated. Finally, I'm pleased to announce, on a separate matter just before taking questions, I'm pleased to announce that we are making a significant progress in accelerating the pace of the COVID-19 vaccine program. As you know, when I participated in an update on Tuesday, I expressed our disappointment with the pace of vaccination in the first 2 weeks of the program. But I'm pleased to say that AHS has responded by significantly increasing the pace of vaccinations. They, contrary to their original plan, scheduled vaccinations today. And in fact, I want to thank all of those healthcare workers who are working on a statutory holiday to help to inoculate Albertans from COVID-19. We anticipate about 3,000 vaccinations today, on top of 3,142 that were performed yesterday. And so we should be at or above 17,000 Albertans having received their first dose of either the Pfizer or the Moderna COVID-19 vaccine by the end of today. So we've moved from a pace of about 500 patients or Albertans being vaccinated a day to about 3,000 now, and we're on the way to a pace of 4,000 a day. This has in part been facilitated by the arrival and approval of the Moderna vaccine, which is being administered in long-term care facilities and other congregate seniors care facilities right now. And that is a very important turning point in the progress of this critical vaccine program. Again, let me thank the healthcare workers who are on the job today administering that vaccine. And I'll reiterate that there is, at this point, really nothing more important than getting as many people as vaccinated as we possibly can, particularly in the vulnerable elements of Alberta's population. And with that, I'm happy to take questions.
I'll ask those on the line to be brief and limit themselves to one question, as we have a lot of reporters in the queue today. Operator, can you please put through the first caller?
Premier, I'm just wondering if you can answer this. We, throughout the last few days, while this was developing, haven't had a whole lot of responses from your press secretary, or we haven't heard directly from MLA. I'm wondering, are MLAs not allowed to their own actions?
Sure, they're allowed to, and MLAs are speaking issues to their constituents and to media all the time. So I have no problem with that.
Operator, can you please put through the next caller?
Rick Bell, Calgary-Sun. Good afternoon, Premier. I have to admit I'm a bit gobsmacked today. I realize you didn't have a clear directive, but why, and I know all the legalities involved, but with most of us sitting here in Calgary and Edmonton and other places, binge watching movies and catching up on the latest reading, the fact that you didn't issue a clear directive, do we have to have a clear directive from you before people in your government have the moral compass to know what to do and not to travel overseas in the middle of the decisions you made in December, whether they're working in Hawaii or working somewhere else? I mean, don't you see that as somewhat problematic, that they don't have their own internal, they don't seem to have their own internal moral equipment to do this without getting a directive from you? I'm just gobsmacked. Perhaps you could address that.
Sure, Rick. Look, I think it was a significant error in judgment, and Minister Allard has told me that herself, and has or will be issuing a statement to that effect. And I am not happy that people chose to travel abroad, people who are in positions of public trust, that there's a reasonable public expectation that we'll be held to a higher standard than simply complying with the rules. And so people are right to be frustrated with that. Rick, in terms of sanctioning people, I don't think it's reasonable for me as a leader to sanction people who very carefully followed the public health orders and the legal requirements in a province where we have been, frankly, encouraging safe travel. I think they made a mistake if they were in a position, as people in a position of public trust, to have done so. And that's why I've asked those folks who have been abroad, including Minister Allard, to come back right away. And that's why I'm issuing this clear directive today that we will not accept folks in senior positions of leadership, public trust, from traveling abroad. I'm not happy with this, but I have to take responsibility that I wasn't absolutely clear that there should be no international travel, at least not for reasons that are unrelated to business emergencies.
Operator, can you please put through the next caller?
Hi, Premier. This is for you. I was speaking to an Alberta doctor this morning. She works in a COVID hospital ward. She just said, everyone's exhausted, frustrated that their colleagues aren't going to get vaccinated, being in a COVID ward and being exposed with every day until February. So she wanted to ask you the question, explain to them why they're so far down the line and why there aren't 24-hour vaccination clinics available.
Well, in terms of the prioritization of folks in the healthcare system to receive the vaccine, that has been based on the advice of our COVID Scientific Advisory Committee that has given us who they believe are the frontline healthcare workers most urgently in need of inoculation, and that has started with respiratory therapists, ICU nurses, and I do know that some physicians, frontline physicians, have been inoculated, so I'm not sure exactly the position of the doctor with whom you are speaking is, but I know personally of doctors who have reached out and said that they were very happy in the first week or so to have gotten their first dose. Look, obviously, let me just back this up a step. Let's remember that in the spring and summer, when people were talking about a vaccine possibly being available by the end of the year, that was met with fairly widespread derision, and people thought it wasn't possible. So thank God we're in this situation. I guess I would call this a good problem to have, where we are ahead of the original anticipated vaccine schedule. Secondly, we didn't expect to receive any vaccines until the new year. And I do understand the federal government was a little bit behind other countries in getting in the queue with respect to finalizing contracts with the major vaccine providers. Having said that, we do appreciate their efforts over the past month to accelerate the delivery of vaccines. But the bottom line is we only have so many doses. I don't have the exact number with me, but it's in the range of 30,000 first doses available. As you know, I was not happy with AHS's decision to withhold half of the vaccines in our current inventory for administration of the second dose. I thought that was that was excessively cautious, that we know we're getting large shipments in January, and that we should proceed with using all of the current vaccine doses in the inventory to roll that out to as many frontline healthcare workers and long-term care residents as needed. So bottom line is we're following the scientific advice. The decision of who in the healthcare system is vaccinated and when is not, of course, a political decision. It is a decision of the scientific experts. But bottom line is that fortunately we have now in this course of this week, we've more than, in fact, since Tuesday, we've more than doubled the number of Albertans who've received a first dose, and we have increased by 600% the daily vaccination rate. So I hopefully that we'll get to that doctor and others in need of this vaccine as soon as possible.
Operator, can you please put through the next caller?
Yeah, g'day, Happy New Year.
Happy New Year.
So, did your Chief of Staff, Jamie Huckabee, travel to the UK in December? If so, it sounds like he won't face any consequences, and nor will any other staffer or MLA who travels outside of the country.
Sure.
With the official recommendation of the government.
Yeah, thanks, Emma. Yes, Mr. Huckabee did travel with family before Christmas to the UK, and when the situation with the new variant emerged there, immediately changed his plans and came back to Canada on Boxing Day through the United States, and was very forthcoming with the Public Health Agency upon arrival here in Alberta about where he'd been and how he traveled, and is observing their 14-day isolation requirement right now. And as I said, I'm aware of other members of staff and as well as senior government officials who have traveled abroad in recent weeks. And I regret that I did not make it patently clear that international travel would be inappropriate for people in senior positions of leadership. And not because it violates the rules, but because there is a reasonable expectation that we maintain a different standard, a higher standard. And in terms of the advisory, you're right, there is an advisory against non-essential travel, but as I've said, Emma, it's clear that hundreds of thousands of Canadians have traveled in the past year. Tens of thousands of Albertans are abroad right now. Upward 10 to 20,000 people are moving through Alberta airports every day. I think the majority of them right now are actually going outside the country to warmer destinations. And I'll remind you that we have Canada has a border management agreement with the United States right now to restrict non-essential travel across the border, but at the same time, this huge volume of travel is being accommodated. And so I think it comes right down to this, that the advisory of what is essential is a subjective standard. People are determining that themselves. They are, if they're going to the United States, they are presumably affirming to U.S. border agents that the reasons for their travel are essential. The bottom line is this, we have advisory language, but then we have public health orders with binding legal force. And I say to all of those folks who have traveled or are planning on doing so that the critical thing is that they carefully follow public health restrictions all the way through in the jurisdiction where they are staying, and obviously in their return that will now in a week require proof of a negative test, and of course, most importantly, upon return through self-isolation. So those are the restrictions, and let me restate what I said earlier, which is that I know there's a tension here, Emma, and I've acknowledged that from the very beginning, that we have this language about avoiding non-essential travel. At the same time, people are going to travel. We are not a country with exit controls, and we have no legal power to compel people not to leave the country. That in fact would be a federal authority, which they've not exercised. Then I think they've been right not to exercise it. So the key here for us is a approach that permits safe travel. As I've said, the studies from Harvard University, the U.S. Department of Defense, and others have indicated that the risk of viral transmission in airplanes is almost negligible. There's hardly any evidence of cases of viral transmission. And as the Harvard study concluded, people are more likely to be infected doing regular daily activities. That's because of extreme care taken by the airlines. We thank them for that. This new federal policy will add another layer of protection, and that is how that's how I square the policy objective, which is to protect both lives and livelihoods.
Okay, we have time for 2 more questions. Operator, can you please put through the next caller?
Premier, isn't Minister Allard a bit different here in the sense that she actually has a role in COVID programs as the head of essentially the head of provincial emergency management? This is a minister who is directly involved, and just at the time when these plans were starting to be developed for distributing vaccine and so forth, she's out of the country. Could you please tell us how long exactly was she out of the country for? When did she leave and when did she come back? Would you try to square that, or
Sure.
tell me what you think about that being a case of a minister who
Thanks, Don. Well, this is one of the reasons I was disappointed in the decision that she made. And she, I think, recognizes in retrospect it was the wrong thing to do. And she has certainly apologized to me, and I will be issuing a statement offering a public apology for that lack of judgment. I can say that she continued to work on her important responsibilities, just as ministers are doing typically from home right now, with Zoom calls and phone work and email. And nevertheless, she should have, I think, stayed here for obvious reasons. In terms of when she left, I understand that she left on December 19th. I learned about her travel on Tuesday afternoon of this week, after the situation in Toronto became, in Ontario became a controversy. My staff inquired with ministers if they were here. We found that Minister Allard was the only minister who was not in the country. I contacted her right away and expressed concern and disappointment and asked that she come back, and she did so immediately.
Operator.
Sorry, one other thing, I apologize. That just to add one point, which is that Minister Allard is in no way directly involved in or responsible for the vaccine program. I know that the official opposition here is suggesting that she is. That is not the case. The responsibility for the vaccine program belongs entirely within Alberta Health and AHS in particular. Deputy Minister Winnick is chairing a whole of government vaccine task force, basically to provide a degree of oversight and advice on the logistics. And we appointed him to that not because of his role as Deputy Minister of Municipal Affairs so much as his previous role as Commander of the Canadian Army and Vice Chief of Defence Staff. So he brings to the Alberta government tremendous technical expertise on matters of on logistical matters of this scale. So that is a technical role that he has, which has no relationship to the Minister or Ministry of Municipal Affairs per se.
Operator, can you please put through our final question?
Thank you. The final question is from Terry Reid, CBC.
Good afternoon, Premier. Thank you very much for taking the call. I just want to be clear here. You're saying that you were not aware that Minister Allard was out of the country until Tuesday. Were you aware of other MLAs and senior officials that were leaving the country in December? And if so, why not issue the declaration then? And who are the other MLAs and senior officials that have to travel?
So with respect to you asked about MLAs. I was not aware of any MLAs being outside the country until this week as well, when all of this became an issue and inquiries were made. So I do recall that our Chief Government Whip at our last pre-Christmas caucus meeting strongly encouraged MLAs to stay in the country. And I do know that a number of people over recent weeks have canceled travel plans because of the more recent stringent restrictions, recognizing that this would be problematic for them to travel abroad. I don't have a comprehensive list of everybody amongst the hundreds of government political staff and senior officials and others who may have traveled abroad. I was aware of I was not aware of any MLAs or ministers traveling abroad until this week. And I regret not having issued a very clear directive against international travel for people in positions of senior leadership. I should have done this earlier. I regret that I didn't, and I take responsibility for that. Let me reinforce that I really don't believe I can impose sanctions on individuals who did not violate the public health orders or the law, who have returned to Canada or are in the process of doing so. Again, it will be very clear going forward that this is not to be tolerated in the future.
Okay, we'll leave it there. Thanks very much.
Thank
and Happy
you,
New Year.
and Happy New Year again, everyone.